My name is Israel Estrada. I am with the Oregon Health Insurance Marketplace. I'm here to talk to you about some of your health insurance options, both as Oregonians and also specifically as beneficiaries of the TRADE Act. So the first thing I'm going to talk about is specifically what I represent, which is the Oregon Health Insurance Marketplace, which we work very closely with healthcare.gov. Healthcare.gov is a one-stop shop for you guys to apply for financial assistance, shop for coverage, and enroll in a plan all in one place. Something to keep in mind is that there is financial assistance available for those of you that qualify, and it is based on a sliding scale, so the less you're making, the more help you're going to get. So you want to make sure that you're basing whatever information that you're putting on that application off your current information, whether the current income is unemployment or if you have a new job. You want to make sure that you are using the information that you know right now to fill out that application. What that assistance will do, first thing you potentially qualify for is something called a advanced premium tax credit, APTC is the official term for it. And what that is if you qualify for that, you can lower your monthly bill by a set amount every month, or you can save that up, bank it for the end of the year, and just get that all back at once when you file your taxes, whatever would work best for you. So as an example, let's say that you applied and you were approved for $300 a month of tax credits. Then whatever plan that you enrolled into through healthcare.gov, you would lower the monthly premium by that $300. Or you have the option, if you have the finances available, you can save all that up and just get a huge refund when you file your taxes at the end of the year. So it's up to you to decide how you want to do that. Generally, most people will take that monthly premium because without that, it gets pretty spendy trying to afford it without that help. The second thing I'm going to mention to you is something called a cost sharing reduction. And what that is when you have health insurance, even when you're covered, you still normally pay a cost when you actually use your coverage. So if you go to the doctor, you're paying a $20 copay for your office visit. If you pick up your prescription, maybe you're paying $10 to $15 for that prescription, depending on your level of coverage. What a cost sharing reduction does is anytime you are paying for something out of pocket, not including your premium, it lowers the cost of that payment. So for an example, if you qualified for a cost sharing reduction and you went to that doctor and normally it was a $20 office visit copay, that copay might become a $5 copay. If you go pick up your $15 prescription, it might be lowered down to a $3 prescription. And it's all built into the cost. So whenever you actually are paying for it, you're not going to have to claim a rebate or anything like that. That's the cost that you should have to pay when you actually go and pick up those or utilize those services. So another way that it helps people out is that with every private health insurance plan, there is something called a maximum out of pocket. And what that is the insurance company keeps track of how much you spend throughout the year for those doctor visits, your prescriptions, any durable medical equipment. And once you have spent an amount equal to your maximum out of pocket, the only thing you're responsible for paying for the rest of the year is your monthly premium. It doesn't matter if you suddenly need a major surgery, a transplant. If it is a covered service and you have met your max out of pocket, you're paying $0 for the rest of the year for that covered service. The only thing you're paying is your monthly payment. And if you're qualifying for cost sharing reductions, you're also qualifying for tax credits. So that monthly payment you're also getting help for. For most adults, that max out of pocket is about $7,000. But if you qualify for the cost sharing reductions, you can get that max out of pocket to at or around $1,000, which is a very significant savings and especially useful to anyone that's in a household with someone that has a chronic condition or is a high utilizer of services. So there's a diabetic in the household, somebody that uses a lot of medications, you will reach that cap very early in the year. And the only thing you're paying for the rest of the year is that monthly premium. So that is two different ways that you can get help from the marketplace. Something very important to remember is that you're only allowed to enroll into the marketplace plans through healthcare.gov during certain times of the year. You have your open enrollment period, which is November 1st through December 15th. If we're outside that period, you need something like called a qualifying life event to let you shop. Some of the more common ones are if you've recently lost coverage in the last 60 days. So if you had coverage through your employer and you recently lost that coverage, you'd have a special enrollment period to enroll. If you're brand new to Oregon, you might have a possibility to enroll. You can also use that special enrollment period to enroll into your spouse's coverage through their company if that's available to you. So that's something to keep in mind. And if you're not sure what the best option is for you, by all means, feel free to reach out to us. We'll tell you how to get that contact information at the end of this presentation. Next thing I'm going to mention to you is COBRA coverage. I'm mentioning it to you right now, but I know for many of you, you're going to be outside the normal enrollment period for COBRA, but we just want to make you guys aware of it because there are some special rules with COBRA and the TRADE Act. COBRA is just a continuation of whatever existing health coverage you had through your previous employer. So whatever you had with them, it's the same cost, same provider network, same out-of-pocket cost when you actually utilize the coverage. The main difference is your old employer is no longer the administrator, and you are the one responsible for making those payments. And without that help from the employer, the COBRA coverage can be very spendy. But if you did enroll into the COBRA coverage, you have some special things that apply to you. First of all, the COBRA coverage is one of the few private plans that you are allowed to access your health coverage tax credit, the one that's tied to your TRADE Act benefits. It's one of the few plans that you are allowed to apply that monthly like you would through the marketplace. With every other type of coverage, the HCTC, the health coverage tax credit that you get from the TRADE Act, only applies when you take it at the end of the year. But if you are enrolled into COBRA coverage, you can take that monthly. So that is one advantage to it. So if you did enroll into COBRA, that is something that you can remember and take advantage of as soon as you are approved for TRADE Act. If you did not take TRADE Act when you first were let go, you only have a 60-day window to enroll into it. So if you're outside that window, you will not be able to enroll into the COBRA coverage. So many of you may not have the opportunity now, but if for some reason you are still within that window, COBRA could still be an option for you. So remember, for the COBRA coverage, same coverage as before. Pretty expensive without financial assistance. However, if you are approved for the TRADE Act and are receiving benefits, you may qualify for a tax credit to reduce your COBRA cost. When you are separated from your employer, you only have a 60-day window to enroll into that COBRA coverage. And if you miss that window, there is no opportunity to get it back at a later date. So please keep that in mind. If you are still within that window, you need to act quickly. Next thing I'm going to mention is the Oregon Health Plan. Oregon Health Plan is the state version of Medicaid. It is a need-based program, so need is determined by your income and household size. And typically the way it's going to be is your income has to be below a certain level in order to qualify. For most adults, the amount that you need to make in order to qualify for the Oregon Health Plan is 138% of the federal poverty level. It's not very much. Even on unemployment, even on the TRADE Act benefit, you're probably still going to be making too much for that. And that information is found here. This document is available in English and Spanish for those of you that need it. And what I want to do is I want to point you out to this column on the left-hand side. That is how much you can make as an adult and have the adults covered under the Oregon Health Plan. It's not very much. Many of you will still make too much even if you're on unemployment. But what I always like to point out to households is that column on the second from the right-hand side, where it says OHP for kids. Oregon Health Plan defines children as anyone under the age of 19. That is how much you can make and have any children in your household covered under the Oregon Health Plan. That amount is significantly higher. It's almost 3 times what an adult can make. Nice things about the Oregon Health Plan, unlike some of the other things, there's no time restriction, there's no certain time of the year that you can get it, or special windows. If you qualify for the Oregon Health Plan, you get the Oregon Health Plan regardless of the time of the year. It's also zero cost coverage, which means there's no monthly premium, and any covered service is covered at 100%. So it is very nice coverage that's available for you. It's also going to be all the minimum essential coverage that a private plan would have. It's just going to be administered by the state of Oregon. But something to keep in mind is because those kids get expanded eligibility, it's very nice that even if you can't get coverage for yourself, you can at least make sure that any children in the household that are under the age of 19 can get coverage. And remember, that's zero cost coverage. So anything that they get through the Oregon Health Plan is savings for you, so that the adults can have more money available to them to handle their particular needs. So just something to keep in mind. I always like to say OHP may not be the sole answer to your questions or your options, but it might be part of the solution for you. So please keep it in mind. This chart can give you a rough idea of whether you would qualify or not. And finally, the next thing I'm going to mention is Medicare. Medicare is a public program for people that are 65 and older or have been on disability for 24 consecutive months. I think this part of our presentation is really important just because with Medicare, when you turn 65, there's not a lot of information or guidance given to you. The feds send you a 200-page book called Medicare and You, and it's kind of up to you to figure out what to do from there. And there's a lot to know when it comes to Medicare. Do you need Part A, which is your hospitalization? Do you need Part B? That's your doctor visits, your examinations, your medical equipment, testing. All right. Do you need prescription coverage? Well, you can get that with Part D, which is a standalone prescription plan. Or you can bundle all the services together with a Medicare Advantage plan, also known as a Part C. On top of that, you have the decision as to whether you want a supplemental or a Medigap policy. And I think if you're confused by that word salad I just threw out there, a lot of people are. And that's why my agency exists, because if you don't know the answers to those questions, if you don't want to have to put all that work in and do all that reading, our agency's done that for you. We do Medicare counseling across the state of Oregon, where you can meet face-to-face with someone who can talk with you about your options, whether it's, hey, I'm brand new to Medicare, what do I need to know? Or, I've been on Medicare a few years, do I need to change my plan? If you have any questions about Medicare, you can always check with us through our agency called SHIBA, Senior Health Insurance Benefits Assistance. Contact information is going to be in this presentation. It's on this slide right now that you're looking at. So please feel free to reach out to us. And maybe you're not in the particular age group for Medicare, but maybe you have a parent or grandparent that might need assistance. By all means, send them to us, because the things that I've discussed are all options that are available to any Oregonian. They're not particular to the TRADE Act. The only benefit that's been discussed in today's presentation by myself and my colleagues is the HCTC. That's the only one that's tied specifically to TRADE Act benefits. But the Marketplace, Oregon Health Plan, Medicare, and even the COBRA information, all of that is available to any Oregonian, provided that they meet the qualifying circumstances. So some key things I want to remind you guys of. Remember, the Oregon Health Plan can be applied for at any time of the year. COBRA coverage and the Oregon Health Insurance Marketplace do have some limited availabilities. So you either have to be within the 60-day window that applies to you, or in the case of the Marketplace, also during open enrollment. So remember, for the Marketplace and COBRA, 60 days from your last day of coverage, you have an additional window through the Marketplace from November 1st through December 15th. I guess the key thing to remember is that we're not expecting you to remember every single thing that we discussed here today. If you have questions, please reach out to their coworkers. If you have a question about the TRADE Act, if you have questions about any of these particular programs, please reach out to me directly. We're happy to walk you through and point you out to where you need to. Part of your packet, you should have a sheet that clarifies, that has a short summary of everything that I discussed here today. So if you need information about the Marketplace, there's a section on that sheet that has our contact information. If you need information on or how to get a hold of the Oregon Health Plan, that information is on there as well. There's even a link on that form that tells you exactly where to find out information about the health coverage tax credit on the IRS website, as well as having information about the SHIBA program. So basically, that form has contact information about everything that we discussed here today. So even if you don't remember anything that we told you, just please remember where you can find the answers to these questions. They're on that form. By all means, feel free to call my agency or reach out to me directly. We're happy to walk you through these because we understand healthcare is pretty complicated, especially when you have all these options available to you. So we want to make sure that we are available as a resource for you to take advantage of.